I've decided I am going to, I did contemplate that as well about, are we happy for Palliative Care Week? But indeed, I'm happy for quality palliative care.
Yeah.
So, therefore, happy for Palliative Care Week.
Great, as it should be.
Yeah.
So can you see us?
I can't see any participants, but I can certainly hear people.
Okay, and is that the choice that you guys have made at your end, or is it something I'm doing wrong at my end?
No, it must be on...
Because I can't see anyone else except you two either.
Yeah, it must be on your end. I'm not sure what's going on, but that's okay. So I think so long as we can hear each other, and you can post questions in the chat, which we'll get to later on. But it's 1 minute past, and I'm aware that everyone's really busy, so we might get started. Laura, do you want to launch us off?
I do. So welcome to PACOP, coming to an aged care home near you. So for this Palliative Care Week, we really just wanted to catch up with people and spread the word that PACOP is here, we are coming, and we just wanted to give a really brief overview. So I'm Laura, I'm one of the improvement facilitators, and this is Janelle, she's our National Quality and Education Manager. And so we have designed this for you. Please note they're people from aged care, palliative care, organisational executives. We've got a really broad audience that this recording is going to be sent to. So if you have more specific questions, please take note of our contact details at the end and feel free to reach out to us.
All right, let's get started. I do want to start by acknowledging the traditional owners of the land that we're meeting on today, the Aboriginal and Torres Strait Islander peoples, and I want to pay respects to the elders past, present, emerging and future. And I also want to acknowledge that this is Palliative Care Week, and Palliative Care Australia is instrumental in getting the word out about doing palliative care right. And speaking of doing it right, the theme for this year, for 2022, is It's Your Right. And what a perfect opportunity for us to talk about that right is extended to residents in aged care, and we hope to share that with you today through what we're doing in our PACOP program.
So what we thought we'd do today, because we've got such a broad audience coming in, we thought we would give you a bit of a lay of the land about what's happening in residential aged care in Australia at the moment with palliative care, what's some of the data showing us, and why PACOP was needed. So then we're going to talk about the development of PACOP, so how we came about, and how the program's developed here to have two collections. And so we'll talk a bit about that for you, so you've got a basic understanding of how we work. And then we're going to talk about what's in it for your aged care home. Why should you do this? You know, what have we developed that's really going to add clinical value to your residents? And then at the end, we've got a really nice gap of time just for a quick chit chat and some questions to really answer anything that you're not quite sure about.
So to give you a background of residential aged care in Australia, mind you, it's very brief because we have a short amount of time, but the background I wanted to give to you is to set the stage that aged care homes are major providers of end-of-life care. We know the data tells us that more than 60,000 people die every year in residential aged care. Almost 40% of them will die within the first year, but 1 in 5 will die within the first 3 months of being admitted. So it's really clear that aged care homes are major providers of end-of-life care. And that's not news to us who have worked in aged care, and it certainly won't be news to you people out there who are listening who work in aged care. But it was interestingly news when the Royal Commission came out, and other people who weren't familiar with aged care went, oh, people die in aged care. So you knew that, we know that, but what we don't know is how well residents are receiving palliative care and how well they are dying. Because we found out through research and through the Royal Commission that there was no national approach to identifying, assessing and responding to the palliative care needs of residents, and there's no national measure of outcomes from that care. So this led to a brainstorm, which eventually led to PACOP. But here's the journey of how it went. So some of you may be familiar with PACOP, that stands for Palliative Care Outcomes Collaboration. And that is a well-established palliative care outcomes centre that has built in since 2005 a clear assessment, a national assessment and response framework to embed point of care outcome measures for clinical practice in palliative care. It's well established, it's evidence-based, it's well proven that it has led to clinically significant improvements and statistically significant improvements in palliative care. And they now look after over 200 specialist palliative care services throughout Australia, accounting for around 90% of patients receiving palliative care. So, building on their excellent foundation, we thought, wait a minute, what if this model could work in aged care? So, with funding from the Wicking Trust, PACOP, the PACOP model, was trialled in aged care homes to see if it could improve outcomes in palliative care and aged care. Massive evaluation had occurred and reports were compiled and presented. And as a response to the success of that program, the PACOP Wicking program, trialled in 2019 and 2021, we received full funding from the Australian Government Department of Health to roll out a program nationally to standardise care nationally in aged care. But we wanted to make this program really clinically useful to the aged care sector. So we went back to the aged care homes and got more feedback. And as we've been further developing the program through 2021, all of 2021, we believe we've now finalised a program that really we've used extensive feedback from the aged care sector to make it clinically useful and basically as a way of standardising what aged care home staff are already doing. And so it's resulted in two main collections. One is called the final version of PACOP, one is called Profile Collection and one is called the Outcomes Collection.
So what do we mean when we talk about there being two collections? What we found from the aged care homes from the trial was that there were really a couple of points where we needed to assess residents and identify the need for palliative care. So the way that we decided to address this was to develop some different tools. And so the PACOP Profile Collection, this is our routine assessment of all residents every 3 months. So this links back to that data that showed that 1 in 5 residents pass away in their first 3 months. So that's a really critical period to identify them for palliative care needs. So we've got this tool, we do it every 3 months on the back of your care plan routine reviews, on the back of a resident of the day if your facility is using that policy. And so we incorporate it into your existing model of practice. The other thing that we did was we developed a tool for the deteriorating resident. So we realised people's needs change outside of their routine assessments. So what you can do, you grab this tool for any resident at any time. If there's staff concern, if there's family concern, if your care workers are reporting their needs have changed, the staff can grab this tool and it uses the validated assessments to inform their clinical judgment. So these tools guide resident care planning and it's the anticipatory palliative care planning as well, which is going to reduce those crisis responses that your staff are responding to and the burden on them. So the second part of PACOP is the outcomes collection. And so this is the doing. We've identified that they need palliative care and this gives you the framework to do the palliative care. So we've got an assess, respond and plan protocol that uses a whole team approach. So that includes upskilling your workforce, your care workers, your healthcare professionals, your registered nurses, and it really improves continuity of care and provides that shared language, which is going to streamline your services and inform your referral pathways as well. And that's always determined by the resident needs. So that's our outcomes collection.
So the profile collection incorporates a suite of 5 assessment tools, and those who would be familiar with the PACOP, the Palliative Care Outcomes Collaboration Tools, would see that 4 of them are included here. And we've also added one that assesses frailty. So the tools in the broad sense focus on a resident's functional status, their pain and a range of other really important symptoms and problems, both for the resident and the family, and also frailty in both the physical and cognitive domains. Profile collection also gathers really important information that can guide care planning related to resident needs for around communication, their psychosocial needs, and any advanced care planning needs. Oh, just lost. Okay, sorry about that. We lost screen for a moment. Hope you all can still see that. All right, so I'm always saying you can't fix what you don't know, or you can't improve what you don't know. So one of the goals that PACOP wants to do is help aged care homes understand what they're doing and being able to understand it well so they can target areas to improve on. And so here's how PACOP facilitates that. So we assess the residents routinely. You record those assessment scores. That enables you to track symptoms, problems, and also really comprehensively plan and review their care. And collated information about those resident assessments are sent through to PACOP every 6 months, and we provide a detailed report back to the aged care home so that they can actually know what they don't know, and then they can target areas to work on to improve. The other aspect we will eventually build, as PACOP has done, is a national suite of benchmarks for quality palliative care and aged care. And we will see later on how PACOP has definitely used that to improve palliative care over the years, and we really seek to do the same in PACOP. Now, successful implementation requires planned collaboration. So we have the remit of getting standardised assessment and care into all aged care homes in Australia, and as some of you may be aware, there are almost 3,000 aged care homes, so we can't do that alone. And we have a planned collaboration model, if you like, to achieve success in implementing PACOP into aged care homes. So one of those ways is that we will collaborate with people working in aged care homes, and through a train the educator model, we will train them and support them through the entire education and implementation of PACOP. How do we do that? We establish really comprehensive communities of practice, which are small groups of like people working together towards embedding and standardising practice to improve care. And we are also supported by a range of improvement facilitators like Laura. So every community of practice is led by a PACOP improvement facilitator to provide that ongoing support, whether it's educational or through implementation, barriers and addressing those and helping provide resources and needs. So that is another important function that we provide. And also PACOP works with other key players in the palliative care education space, such as LDAC and PEPA. LDAC, PEPA and PACOP are all funded by the Department of Health in the same way. And actually we work very nicely together in that LDAC and PEPA provide the foundational knowledge and understanding of palliative care, and we provide the tools to do palliative care. So it's actually a really nice cohesive relationship when it comes to collaborating in that space.
Over to you, Laura. So what are the benefits of PACOP? Why should you use PACOP in your aged care home? So as I kind of briefly touched on in our profile and outcomes overview, we have points of assessment for every resident in your nursing home. No resident is going to fall through the cracks if it's 3 a.m. or if it's every 3 months. We've got something there for your staff to go to guide their clinical judgment. So PACOP is going to empower your residents and families. So speaking of this week, it's your right. And as we know, we've got all our policies for respect for dignity and ageing in place. PACOP provides a framework for those staff to engage with the residents and the families to really advocate for what those residents' values are and what their needs are. And it really makes sure that they're involved in that assessment process, they understand projected needs and anticipatory planning. And so some of our PACOP tools, if you're aware, as we've taken them into PACOP, we've included those tools that include the clinician assessment, so what they feel is the resident's needs, but also what the resident and the family needs. And that's really important because there's often a difference between what clinicians feel is bothering the resident, but what the resident's actually really focused on and what would improve their quality of life. And that's what we want to improve. So it's a really good way to marry that up. As you can see on the slide, if your home participates in needs rounds and those referral process, we're going to streamline and improve that. We give you the tools, and it really upskills the staff and gives them that shared language. And before you know it, they're going to be speaking that at handover. They're going to be saying to each other, I'm worried about Mrs. Smith. Her Rockwood's changed. I think we need to go back. And In the same way, it will help with the ANAC as well. So the ANAC, as you're maybe aware, is the new funding model that's coming in October. And so we share 3 tools with the ANAC, and what that does is identifies for you really clearly when it's clinically significant that the changes have occurred. So as you can see, the aged care quality standards as well, we map really nicely to those, and we've actually prepared some documents. If you're interested in some more information on how we map to the standards and the body of evidence that we can help provide to your aged care organisation, please send us an email and we'll happily forward some more information to you there. And it really is that whole team approach. So getting everyone involved to really focus on the quality of care for residents and improving those outcomes.
I touched on this briefly when I mentioned PACOP's suite of benchmarks. They have 20 benchmarks related to quality palliative care for patients. And we aspire to do the same that PACOP has done. So here's an example in front of you. This is a PACOP benchmark that's stating that 90% of patients who are unstable will be so for 3 days or less. So meaning want to get their needs addressed really early. And they set this benchmark quite high back in 2010. And I can remember being a community palliative nurse at that time and going, whoa, how can we ever achieve this? When we first, going back to saying what I said, you can't fix what you don't know. When we were made aware of how we were performing, it really set us a target to aim for. And as you can see, it only took 5 years to increase that more than double. And now, after 10 years, so we do know what we don't know now, and because we it's been made known, we can work towards fixing it. And you can see there the closing of the gap of those 3 areas of care, inpatient and Australia-wide and in the community. And we seek to do the same thing for palliative care in aged care, is to improve national outcomes. So we'll now enter into our Q&A session. And I know, Laura, you've got a whole bunch of questions that people have emailed in earlier.
Yep.
And it's an opportunity for anyone online to either speak up and ask a question or post a question through the chat. I'll just briefly also leave this slide up here while we're answering some questions. So it's just saying thank you to turning up. And thank you to those who signed up but can't be here right now but intend to listen to the recordings. And I just want to thank you for taking the time. We are excited about this program, as you probably gathered by our presentation enthusiasm. And PACOP is funded by the Australian Government Department of Health. I want to acknowledge that, but more importantly, here are our contact details. So that's our email. And also we have a website, so that's the address for our website, where you can also look further at our program. And there's an inquiries form as well if you want more information, use that. I might stop sharing now whilst we answer some of these questions. Or do you want to ask our first one?
Yeah. So our first one. My facility has a current outbreak of COVID and high staff turnover rate. We're very nervous about the changes already coming with ANAC. How is PACOP going to help our workload?
Right. I'm just trying to, sorry, can you, I just missed that because I was filling with the screen.
So our facility currently has an outbreak of COVID and a high staff turnover rate. We're very nervous about the changes already coming with ANAC. How is PACOP going to help our workload?
Yeah, that's a great question. And so, as with any new intervention you bring into a care facility, there is that initial component where it does take time. And what we found in our trials that we were conducting, we did ask them, participants, to trial how long and record how long it took them to complete profile assessment. And on average, it took new beginners with the tool about 10 minutes to complete. And as you can imagine, that time decreased over, as they became familiar with the tools. And given that the profile is completed once every 3 months, in line with resident of the day, it fits. So what we sought to do was make sure we really understand that the aged care workforce is often overworked, underpaid, and at times undervalued. And we saw that, and we wanted to make sure our program did not add any burden to an already burdened aged care staff workforce. So what we sought to do, and through fine-tuning of the program, through that trial and feedback from you, the aged care home staff, we've developed a program that merely standardises what you are already doing. So after that initial and well-supported implementation stage, it does fit and actually will streamline your care, because you're not looking for which assessment should we do at this time. If you're concerned about a resident, you've got a tool to pick up, and it's got a structured approach to addressing their needs. And so you are well supported through that process when you're implementing, despite all the things that will come at you. And I forgot to mention in the slide back previously when I talked about our development occurred, our trials occurred during the COVID outbreak, during the bushfires, during floods, and during the Royal Commission. So we certainly had everything thrown at us at the time, as well as were the aged care homes that we were working with. But we managed to succeed because it is an evidence-based plan that is going to make a difference for residents.
So one of the other questions that we've come across quite a couple of times is, how will PACOP help me to identify which of my residents are palliative, especially those who have advanced dementia?
Oh, that's a great question, because we know that the prevalence of dementia is really high in aged care homes, and it's important that we address those residents' needs and their families' concerns as well. And the suite of PACOP tools are really well positioned to holistically assess people with advanced dementia. And indeed, we provide the education around that as well. But the tools, as we talked about, provide that holistic assessment where the function, performance, pain, and a range of skills, and indeed pain check is incorporated into our tools for those aged care homes who are using that resource to assess people who cannot communicate their pain. So that's a really valuable inclusion. And indeed, the suite of tools really does address the needs of residents with dementia quite holistically, and also incorporates the family's concerns as well.
So one of the other misconceptions that we've got a question about here, I've heard of PACOP referred to as a data collection. Is PACOP a research program?
That's a great question. Wow, these are great questions. The PACOP is absolutely 100% resident-centred program. You don't see research in our title. Yes, that is one of the things that will occur, because one of the things we've promised is to improve care nationally and maybe internationally. And that can be done through evidence-based research. But the program, PACOP program, is resident-centred in that we want to make sure no resident falls through the cracks. No one is missed. No one with needs that are increasing is lost. So our program focuses on the resident, making sure they are always assessed and their needs are always addressed. That's first and foremost. As a byproduct of that, yes, there is data collected in order for us to then feed back to the aged care home so that they can do local quality, continuous quality improvement. And then as we gather de-identified data, we build a national program that can lead to national quality improvement. And then Australia can be a beacon to the world in the international space in quality improvement in palliative care and aged care. So it's that concentric circle of improvement, but it starts and begins with the resident.
Yeah. Great answer, Janelle. I like to say that too. The data is the byproduct. We like to recognise all of the hard work that your staff are doing, and this helps show that. It demonstrates all the hard work, all the assessment, and all the responsiveness that your care staff are already doing. Yeah. It just shows that we don't want to waste all of that, so we take that data and we put it into use. Yeah. So one of the other questions we've had is about the information. So it says, how can we reassure residents and families that any information is safely collected? So we're talking about privacy here.
Oh, yep. So PACOP has several systems in place. So we work with small aged care providers, and we provide PACOP, I should have mentioned, is free of charge. There's no cost to the aged care provider. And it comes with either the option to some free software that we have designed to facilitate and make that collection of that de-identified data more simple. Plus, we also work with large aged care provider, their IT providers like iCare and Autumn Care, and there's a lot of cares in the IT providers, but we're working with them as well to provide them specifications to embed this into their programs to also facilitate ease of data collection for staff, because we did not, again, want it to be a burden. And the data that we extract, that is extracted and sent to PACOP every 6 months so that we can develop these reports for the aged care homes, is encrypted and de-identified. So we don't receive any identifying information about residents. We merely receive the information about the care they have been provided and the assessments.
I just want to throw out to the audience, is there anyone that has a question pop up through this presentation that they'd like to ask or enter into the chat? Feel free to if you'd like. And I'll ask Janelle one more while you might be thinking of one. Janelle, are there any facilities doing PACOP at the moment, and what do they think of it?
Yeah, that's a great question. Again, I'm so glad people wrote in because the audience is being a little shy. Yes, we have had the original aged care homes that we did the trial with. They are continuing on with PACOP, but we've also had many aged care homes sign up, both organisations, large organisations and individual homes. And what they're loving about the universal comment that I hear is it's so amazing having one tool as our go-to when we're worried about a resident. And that's particularly mentioning the deteriorating resident tool, but they also love the formalisation and the standardisation of resident of the day. They do the same thing each time. There's a really nice ability to get a trend of how that resident's doing and track any deterioration. And they really, what it's been is empowering to them, because with each of the tools is a unique instrument, if you like, to help clinicians determine, does this resident need palliative care? And so it's really been empowering to staff who may have felt less confident, and we know there's a high turnover in aged care and you're getting often new grads and new staff all the time that may not be familiar with palliative care. So these tools are really supporting them clinically and helping them build confidence in their role, and also be confident to address the palliative care needs and start someone on our palliative care, and indeed refer someone to palliative care to specialist palliative care services, maybe external to the aged care home, or those that are available in the larger homes with their own internal staff. So it's been a really great model. And if anyone on here or knows anyone who wants to sign up to PACOP, just again, the website address that we shared earlier is there, or email us directly through that email. But there's an inquiries form on our website where aged care homes are able to send us information, and we'll contact them. I can see one question. Is there an opportunity to do train the trainer workshop days without currently being linked to a residential aged care facility? Certainly that would be an option. You could email us at PACOP, and if we're doing one in your area and it's okay with the other participants, I don't see why it wouldn't be a valuable resource to have someone in the area understanding our tools and the process for their collection and how they benefit clinical care. And in fact, when we go to an aged care home in an area, whether it's, so we might go to one, I don't know, I'll just choose an area like Glen Innes, we will then go to that primary health network that works in the area, the LHD in the area, and any specialist palliative care service in the area, and we approach them and take them through an introduction to PACOP workshop so that they are really familiar, because we're kind of playing in their sandpit, and we want to make sure that GPs, specialist palliative care staff, and LHD, PHN staff are familiar with our program and what it is. As they go into the aged care homes as the local people, they can then help with the delivery of PACOP and ensure, again, its successful implementation. I'm aware of the time, and we're coming up to 10:30. If there's no final comments from myself and Laura, we'd like to say thanks for taking time out of your busy day to join us on this National Palliative Care Week. It's your right, it's your residents' right to receive quality palliative care, and we 100% are passionate about this program, that it will deliver quality palliative care and empower the staff to be able to do that really well.
Yeah.
So thank you for your time.
Absolutely reach out, any question, nothing's too big, nothing's too small, send us a message, we're here to help.
Thank you all so much, and have a great day and have a great palliative care week. Thank you.
Bye. Thank you. You're welcome.